Depending on the state you're in, dental hygienists can remove sutures as an expanded function. So if you can do this in your state, here's how you remove sutures. Now, this is a site over an implant, and the sutures, there were 3 placed, and they were used to kind of hold in this membrane because there was a bone graft done. Now, these are dissolvable sutures, so sometimes they will come out on their own. On this patient, they've come out on the lingual. This is kind of flapping around here, so it's time to get them removed. So, of course, clear the area of any debris. Then you want to make sure you can get underneath the suture, which is easy here because there's already the lingual detached. And I really like these types of scissors where the backside does not have a cutting edge against the tissues. And you're going to get right underneath that suture. I cut the first one. A little bit hard to see here, but I cut the second and third one at the same time. Once they are cut, now you're going to grab your cotton pliers and you're going to grasp the knot and gently pull the suture out to the side. You never want to yank it, and you never want to pull the knot through the tissue. That will be really, really painful. You can see here on this third one, actually, that I pulled it one direction, it became really painful. And then, so I pulled it the other direction. That was painful. So then I pulled it back the other direction and it finally came loose just fine. But if you do get any bleeding, that's normal. You just want to irrigate it out, rinse it. You can compress it just a little bit if you needed to stop the bleeding. Then you always want to count the number of sutures that you placed and compare those to the number that you removed. You want to make sure that that's correct. And then you'll note in the patient record removal of how many sutures and any results of healing.